Hello everybody and welcome to the Thursday edition of Video Clips. And today I'm going to talk about breast cancer. And I'm going to talk about both ends of the spectrum, breast cancer prevention at a very early age, and then breast cancer prevention, or how some people think about breast cancer prevention as women get older. So we'll start with early age. A guy by the name of Graham Colditz is professor and chief of the Division of Public Health Sciences at Washington University School of Medicine. In a recent interview posted on Medscape, Colditz discussed how screening doesn't prevent breast cancer, yay, somebody who sees things our way, and that the most effective way to prevent breast cancer is to start with very young children, and according to Colditz, it's never too young to start. He states that factors like diet in childhood and adolescence and alcohol intake before the birth of the first child influence the risk of breast cancer in that child as she gets older. He's concerned that the discussion of preventing breast cancer usually starts with screening, stating that this is detection, not prevention. More people need to understand that. He goes on to say, quote, "The recommendation of a healthy plant-based diet is clearly consistent with diabetes prevention, but is probably even stronger for breast cancer." He says the same thing about physical activity and avoiding weight gain. Childhood obesity has increased. People continue to move away from plant-based diets, and he attributes the increase in breast cancer incidence to those things, among others that I'll talk about here. Colditz is concerned that alcohol is a known carcinogen. It contributes to 5% of breast cancers, and he advises medical professionals to give this more serious consideration. Weight gain accounts for 32% of breast cancers. Now, there's a lot of talk about losing weight after menopause, but he says that, quote, "Women are better off having not gained weight in the first place." And this is particularly true since breast cancer is less responsive to treatment in premenopausal women, and weight gain increases the risk significantly. Colditz states that breast cancer prevention should begin at the age of 2. Actually, it begins, based on what he says, before the child is even conceived, with parents practicing healthy habits. But he places the responsibility squarely on the shoulders of parents, recommending breastfeeding, stating that children should not be given large amounts of milk, interestingly enough. He says kids should stay active, maintain normal weight, and avoid alcohol in late adolescence. And he says that parents can help by modeling good behavior. Now, the topic came up in the interview about adolescence and the fact that once kids are a little older, they can make choices on their own, they have a lot more freedom. He states some statistics that I think were very encouraging. First of all, between 1999 and 2013, the percentage of adolescents reporting that they had smoked within the previous month dropped by over half, from 35% down to 16%. And alcohol intake dropped by quite a bit too, from 50% down to 34.9%. So he said, we do know that prevention efforts can be effective if they're gone about in the right way. Now, the interviewer, of course, could not resist bringing up the idea that if we start focusing with girls on remaining lean, that adolescent girls could develop eating disorders. So he stated that, first of all, girls who exercise and are involved in sports have less concern about their weight than women who aren't. He stressed the idea that we don't really need to talk about weight, we just need to promote healthy eating and exercise, which is true because those things will lead to ideal weight. But maybe most important, he says, listen, a teeny tiny percentage of girls actually have eating disorders and are underweight, while almost 2/3 of adult women are overweight or obese. So we really have to focus on the bigger problem here. Colditz calls for a national effort to educate the public about cancer risk, and he states that risk starts long before girls even start their periods, menarche, and it's determined by factors like how quickly girls grow. He comes back to the milk topic again. I was really surprised to see this, and he cites it as a contributing factor. He said girls who drink more milk grow faster than those who don't. He goes on to say that eating more animal protein versus plant protein leads to early menarche and faster growth also. He reassures parents by advising that children will grow just as tall eating a plant-based diet, they will just have a longer time in getting there. He expresses concern that, quote, "We do not do a good job of telling adolescents and women in their 20s about health trade-offs and the impact that their lifestyle behaviors will have." He thinks that guidelines should be developed for earlier ages rather than waiting until women are in their 30s or older to talk about breast cancer, and says there really aren't any early childhood guidelines at this point in time that address the issue. He's an important voice of reason, and some of his comments frankly shocked me because he's housed at a pretty traditional medical institution. He could almost work here at the Wellness Forum, but I think that if parents start to see more of this type of information, they'll become more motivated to work on diet and exercise with their children, understanding that this isn't just about how they look, it's about their future and how long they're going to be able to live on this planet healthfully if they don't change their ways. All right, so now let's talk about breast cancer at the other end, adult women and how to prevent breast cancer. And I'll just start by saying I never cease to be amazed at at medicine's unbridled enthusiasm for virtually insignificant findings. Data concerning the efficacy of tamoxifen for reducing the incidence of breast cancer was presented at the San Antonio Breast Cancer Symposium in 2014. Medscape gushed, quote, "It's a gift that keeps on giving," reporting that the benefit of the drug lasted for more than 15 years after women stopped taking it, and that women who took tamoxifen had a 29% lower risk of developing breast cancer than women who took placebo. And boy, does that sound like it's really, really good stuff. But stay tuned, I'll come back with some more information in a second here. So Jack Kuzik, PhD, stated, quote, "I think we have to recognize that breast cancer is truly the epidemic of our century. Treatment's really not enough. We have to really get the incidence of the disease down." So Kuzik and his co-investigators enrolled over 7,000 pre- and postmenopausal women who were between the ages of 35 and 70, and they were considered high risk for developing breast cancer based on family history. They were randomized to take tamoxifen or placebo daily for 5 years. In terms of the women who were enrolled in the study, over half were overweight, 40% used hormone replacement therapy, and 35% had had a hysterectomy prior to the start of the study. So they certainly had family history issues, but these were not healthy women based on what we're looking at here. After an average of 16 years of follow-up, 7% of the women taking tamoxifen and 9.8% of the women taking placebo had developed breast cancer. That means the absolute risk reduction was really 2.8%, not 29%. Risk reduction in relative terms, which is how everybody in the medical profession, not everybody, most in the medical profession like to report results because it always makes things look a whole lot better than they really, really are. Furthermore, while there was a slightly lower incidence of breast cancer in the tamoxifen group, there were 5 more breast cancer deaths in the group taking the drug than the group taking placebo. Now, what I decided to do is to use the same statistical sleight of hand to describe the deaths from breast cancer. And what we end up with is almost 20% higher in the tamoxifen group. Of course, they don't want to talk about the detrimental effects of the drug in absolute or relative terms because it looks really bad. One of the risks of tamoxifen is endometrial cancer, and 20 cases developed in the placebo, 29 in the tamoxifen group. So again, using the statistical sleight of hand relative data, we could report that tamoxifen increased the risk of endometrial cancer by 45%. The researchers chose to report this as insignificant, however. They also reported a somewhat, and this is a quote, "a somewhat unexpected event is the fact that we did see a large increase in non-melanoma skin cancer." The researchers stated that they're perplexed about the fact that healthy women who are at risk, like they have a family history or a genetic mutation, choose not to take tamoxifen. Kuzik told Medscape that, quote, "It's a major issue. Cardiologists have been very effective in terms of identifying things like high blood pressure, high cholesterol as diseases which need treatment. We have to find a way, I think, to make it very clear that women with breast cancer risk should be offered treatment. I think much of the problem is still in the education of the medical profession." That's what Kuzik has to say. Well, here's what I think the problem is. I think people are getting smarter, which means all this stuff I do every week, worthwhile. They're learning how to just say no. So perhaps some women are looking up this information or reading my stuff or somebody else's, and they look at the higher incidence of skin cancer, deaths from breast cancer, endometrial cancer, blood clots, and other side effects of tamoxifen, and they just don't think they're justified with a 2.8% reduction in the risk of breast cancer as a result of taking the drug. And perhaps the fact that Kuzik, our enthusiastic supporter and promoter of tamoxifen, is on the Speakers Bureau for AstraZeneca, the maker of tamoxifen, well, maybe it's disconcerting to them just as it's disconcerting to me. So I don't know, I see this whole thing as just first of all, just pathetic. One more time, researchers misrepresenting benefits and risks and essentially just lying. I don't know how else we frame all that, but I'm encouraged that they're finding so many women are refusing to take the drug. That really makes me feel like all this work is worthwhile. All right, that's it for the week. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.